Hello YouTube, it's Nurse T and I am back with another video. In this video I will be talking to you guys about the nurse residency program that I'm currently in. The program that I'm in is a 12-week program and it's designed for new graduate nurses. If you are kind of like skeptical or you feel like you need more practice or you kind of want to get to know different units that you were not exposed to in in your nursing program, the nurse residency program will probably be a good fit for you. How my program is broken up is that we have classroom time and then we have educator rotations and mentor rotations. So first off, the classroom time. It's kind of like nursing school all over again. In the beginning weeks or the earlier weeks, we did modules and different protocols, and we studied all of that stuff that is specific to our hospital, like how to handle like an incident report and um, different like clocking in, just basic stuff. And then we kind of got into like lectures, as they call them. Like we had cardiac lectures, we had respiratory lectures, we had what else did we have? We had hematology and blood administration. We had oncology, different topics like that. So we would have classroom time discussing topics like that, and then we will also have skill time. So after we get done with the classroom time, that afternoon after lunch, we would go down into the skills lab and practice what we just learned in our lecture classes, which was really helpful because it kind of like refreshed you, kind of brought you back, kind of jog your memory. Look, sometimes we forget how to do things because we didn't have that much exposure to it in nursing school. So the residency program kind of brought it back to light. And so we would have the lecture classes, and then we also have what we call a sim lab. So my hospital has like this separate 4-story building, and nurses, respiratory techs, doctors, PAs, nurse practitioners, we all go to sim lab. Like, I think once you're hired on permanently, you do it like every 6 months, but when you're in the residency program, you do it every 2 weeks. And what that is that it prepares you for like codes. They call it the first 5. So it would kind of prepare you for like your first code, so to speak, when your patient codes on you, or your rapid responses. So we would have like simulations, we would have a mannequin and they will be operating it, and certain things will go on with your patient, and you and your classmates or your team basically collaborate to treat this patient. And we also had sim labs where it was like a patient that just came out of surgery, or a patient that had that just had a stroke. It's kind of like preparing you how to take care of these patients. So I think that it was very helpful. It kind of like, exposes you and kind of lets you see or lets you know what to expect when these instances happen when you're out there on the floor. So our educator rotation is where we had a educator. We followed him or her for 3 days, 3 8-hour shifts. We followed him or her, and we were able to ask questions about any type of documentation in the computer. And also the computer system that took 5 days. That was a 5-day, 8-hour lecture. It was brutal. Okay, so we could ask him any type of questions. We also went over how to do a head-to-toe assessment according to the hospital standards, how to document everything. That was the educator rotation. Now moving on to the mentor rotation, that was 3 12-hour shifts. And how that was determined is in the beginning of the residency program, they would ask you, they would give you like a list of units. I think it was like 16 units. I'm in the Med Surg Academy. We also have a critical care and an ER academy. I chose Med Surg. So within Med Surg Academy, there are 16 different units, and you rank the units based on your interest in those units. And so they place you with your mentors on. We have 4 mentor rotations. They place you on those units according to how you rank them, starting with the lowest ranking unit. So I chose PCU, I chose nephrology, I chose surgical trauma, and ortho. So I am like, we are like a little halfway through the program right now. So last week I just completed my third rotation, which was surgical trauma. I really liked the PCU. I did not like nephrology. Um, I did like surgical trauma. And ninth ortho, I did my capstone there. That's my last highest ranking unit. So I already know what to expect with that. But the purpose of the mentor rotations is to get you exposed. Like starting out, the first one, you were required to have 2 patients for that day. And as you move on all the way to the end, you should have anywhere from 4 to 5 patients. You basically do everything for this patient. You do your assessment, you do the meds, you do all the treatments, you do everything. It's kind of like you're on your own, but you have your mentor close by just in case you have any questions. So that was very, very helpful. I really, like I said, I really like it. I feel like it is preparing me, should I say, for the real world. Yeah, that's pretty much it. I mean, that's really what a residency program is. And the reason why I chose the residency program, well, actually, I would say it chose me, because I was currently at a federal job. I was a rehab tech. When I finished nursing school, I applied for several jobs with my federal agency. Nothing came through. I waited about 3 months. Nothing came through. So I applied to the local hospital for the residency program. Within a week and a half, I had already had 3 interviews, and I was already hired, and I already had my start date with less than 2 weeks. So it kind of sped up, and I actually would have taken, if I had a job at the federal agency, it would have been more money, but then at the hospital is better experience, unlike what I would have gotten if I stayed federal. So that's another point that I want to make. A lot of times we get caught up in the money and all of that, but it's really not as important as you think it is, because as a new nurse, you want to have that good foundation. That way you can make yourself more marketable for any type of job after you complete your residency program. So you kind of want to keep that in mind, what's going to be the most benefit to you. Hopefully it's not the money, because your goal is to be the best nurse that you can be, irregardless to the money that you're being paid. So I would really suggest a nurse residency program, because it is just, I feel like it prepares you. It kind of walks you or gradually expose you into the real nursing world, rather than just applying to a job and just get thrown out there kind of like scared to death, not knowing what to do or what have you. So I would really, really recommend, if you have the opportunity in your city, I would recommend trying out the nursing residency program, because like I said, it exposes you to a lot of, right now, personally, I'm getting exposure to a lot of the units that I did not see in nursing school. And it's kind of like a good way, or your way, of interviewing each individual unit before you choose what unit you would like to be on. So this is kind of like your interview process. And now when I'm completed with the program, we have to pick our top 3 units out of the 5 to interview with. And hopefully we get hired on each specific unit. So it's a great opportunity. Again, I would really suggest anyone that's a new graduate nurse, and especially if you don't know what you want to do or where you want to go, that would be a good opportunity for you to figure all of that out. If you have any questions, please post them below, comment, subscribe, give me any suggestions of videos that you would like to see in the future. Um, Anything like that, I am open to everything. My goal is to really help all of you new nurses, students, and everything nursing. Okay, thank you guys so much for watching this video, and stay tuned for more. Bye.